Hello, my name is Dr. Carlo Oller. I am a board-certified emergency physician with 18 years of clinical practice. In this video, I'm going to provide you with some information about how to quit smoking. Every time you smoke a cigarette, toxic gases pass into your lungs, then into your bloodstream, where they spread to every organ in your body. A cigarette is made using the tobacco leaf, which contains nicotine and a variety of other compounds. As tobacco and compounds burn, they release thousands of dangerous chemicals, including over 40 known to cause cancer. Cigarette smoke contains the poisonous gas carbon monoxide and nitrogen oxide, as well as trace amounts of cancer-causing radioactive particles. All forms of tobacco are dangerous, including cigars, pipes, and smokeless tobacco, such as chewing tobacco and snuff. Nicotine is an addictive chemical in tobacco. After you inhale tobacco smoke, nicotine flows through the bloodstream to your brain, where it induces a pleasurable feeling. When you repeatedly expose your brain to nicotine, it becomes desensitized, making you crave more and more nicotine just to feel normal. Smoking causes death. People who smoke typically die at an earlier age than non-smokers. In fact, 1 on every 5 deaths in the United States is linked somehow to cigarette smoking. If you smoke, your risk of major health problems increases dramatically, including heart disease, heart attacks, strokes, lung cancer, and death from chronic obstructive pulmonary disease. Smoking causes cardiovascular disease. When nicotine flows through the adrenal glands on top of your kidneys, it stimulates the release of epinephrine, a hormone that raises your blood pressure. In addition, nicotine and carbon monoxide can damage the lining of the inner walls of your arteries. What are the benefits of quitting smoking? Quitting smoking can dramatically improve your health and help you live longer. It lowers your risk of heart disease, lung disease, kidney failure, infection, and cancer. Quitting smoking can also lower your chances of getting osteoporosis, a condition that makes your bones weak. Plus, it can help your skin look younger and reduce the chances that you will have problems with sex, like erectile dysfunction. Quitting smoking is not easy for most people, and it can take several tries to completely quit. But help and support are available. It's never too late to quit smoking, and quitting smoking will improve your health no matter how old you are, even if you smoked for a long time. So how quickly will you see the benefits of quitting smoking? After just 1 hour, in as little as 20 minutes after your last cigarette smoked, the heart rate drops and returns to normal. Blood pressure begins to drop, and circulation may start to improve. After 12 hours, cigarettes contain a lot of known toxins, including carbon monoxide and gas present in cigarette smoke. The gas can be harmful or fatal in high doses and prevents oxygen from entering the lungs and your blood. When inhaled in large doses, in a short time, suffocation can occur from lack of oxygen. After just 12 hours without a cigarette, the body cleanses itself from the excess carbon monoxide from the cigarettes. Carbon monoxide levels returns to normal, increasing your body's oxygen levels. After 1 day, just 1 day after quitting smoking, the risk of heart attacks begin to decrease. Smoking raises the risk of developing coronary artery disease by lowering your good cholesterol, which makes heart-healthy exercise harder to do. Smoking also raises blood pressure and increases blood clots, increasing the risk of stroke. In as little as 1 day after quitting smoking, a person's blood pressure begins to drop, decreasing the risk of heart disease from smoking inducing high blood pressure. In this short time, a person's oxygen level will have risen, making physical activity and exercise easier to do, promoting heart-healthy habits. After 2 days, smoking damages nerve endings responsible for your senses of smell and taste. In as little as 2 days after quitting, a person may notice a heightened sense of smell and more vivid taste as these nerves begin to heal. After 3 days of quitting smoking, the nicotine level in a person's body are depleted. While it is healthier to have no nicotine in your body, This initial depletion can cause nicotine withdrawal. Around 3 days after quitting smoking, most people will experience moodiness and irritability, severe headaches and cravings as the body readjusts. After 1 month, in as little as 1 month after quitting smoking, a person's lung function begins to improve. As the lungs heal and lung capacity improves, former smokers may notice less coughing and shortness of breath. Athletic endurance increases, and former smokers may notice a renewed ability for cardiovascular activities such as running and jumping. After 1 to 3 months, for the next several months after quitting smoking, circulation continues to improve. After 9 months after quitting, the lungs have significantly healed themselves. The delicate hair-like structures inside your lung, known as cilia, have recovered from the toll of cigarette smoke took on them. These structures help to push mucus out of your lungs and help fight infections. Around this time, many former smokers notice a decrease in the frequency of lung infections because the healed cilia can do their job more easy. After 1 year of quitting smoking, a person's risk of coronary artery disease decreases by half. The risk will continue to drop past the 1 year mark. After 5 years, cigarettes contain many known toxins that cause the arteries in the blood vessels to narrow. These same toxins also increase the likelihood of developing blood clots. So after 5 years of quitting smoking, the body has healed itself enough for the arteries and blood vessels to begin to widen again. This widening means the blood vessel is less likely to clot, lowering the risk of a stroke. The risk of stroke will continue to reduce over time over the next 10 years as the body heals more and more. Then after 10 years, a person's chances of developing lung cancer and dying from it are roughly cut in half compared to someone who continues to smoke. The likelihood of developing mouth, throat, pancreatic cancers has significantly reduced. Then after 15 years of quitting smoking, the likelihood of developing coronary artery disease is equivalent to that of a non-smoker. Similarly, the risk of developing pancreatic cancer has reduced to the same level as a non-smoker. And after 20 years, the risk of death from smoking-related causes, including both lung disease and cancer, drops to the level of a person who has never smoked in their lives. Also, the risk of developing pancreatic cancers has reduced to that of someone who has never smoked. What should you do if you want to quit smoking? It's a good idea to start by talking to your doctor, like myself, or a nurse. It is possible to quit on your own without any help, but getting help greatly increases your chances of quitting successfully. When you're ready to quit, you will make a plan to set a quit time. By having a specific date and time, it makes the goal more real. Make sure you tell your family and friends that you plan to quit. Set them up as your accountability partners. Plan ahead for the challenge you will face, such as cigarette cravings, and remove cigarettes from your home, from your car, from your work. Make it difficult. Set barriers that will prevent you to fall back into smoking. How can your doctor or nurse help you? Your doctor or nurse can give you advice on the best way to quit smoking. They can also give you medications to reduce your cravings for cigarettes, reduce your withdrawal symptoms that happen when you quit smoking. Your doctor or nurse may also find a counselor for you to talk to. For most people who are trying to quit smoking, it works best to both use medications and counseling. You can also get help from a free phone line, 1-800-QUIT-NOW, or go online to www.smokefree.gov. So what are the symptoms of withdrawal? When you stop smoking, you might have such symptoms as trouble sleeping, feeling irritable, anxious, or restlessness, getting frustrated or angry. These symptoms can be hard to deal with, which is why it's hard for people to quit. But medications can help. Some people who stop smoking become temporarily depressed. Some people need treatment for depression, such as counseling or medications. Or how does counseling work? A counselor can help you figure out what triggers you to want to smoke and how to handle these situations, how to resist cravings. What can you do differently if you have tried to quit in the past? You can meet with a counselor in one-on-one lessons or as part of a group. There are other ways to get counseling too, such as over the phone or through text messaging or online. How do medicines help you to stop smoking? Different medications work in different ways. Nicotine replacement therapy. Nicotine is the main drug in cigarettes and the reason they are so addictive. These medicines reduce your body's craving for nicotine, and they also help with the withdrawal symptoms. There are different forms of nicotine replacement, including skin patches, lozenges, gum, nasal sprays, even inhalers. Most can be bought without a prescription. Also, health insurance might cover some or all of the cost. Often it helps to use two forms of nicotine replacement. For example, you might wear a patch all the time, plus use gum or lozenges when you get the craving. The medication varenicline, or brand names Chantix or Champix, is a prescription medicine that reduces the withdrawal symptoms and cigarette cravings. Varenicline can increase the effects of alcohol in some people. It's a good idea to limit drinking while you're taking it, at least until you know how it affects you. Even if you're not ready to commit to quit date, varenicline can help reduce cravings. This can make it easier to quit when you're ready. Bupropion. Sample brand names are Wellbutrin and Zyban. Is a prescription medicine that reduces your desire to smoke. It is also available as a generic version, which is cheaper than the brand name medications. Doctors do not usually prescribe bupropion for people with seizures or who have had seizures in the past. It might also be helpful to combine nicotine replacement medication with bupropion or varenicline. In some cases, a person might even take both bupropion and varenicline. Your doctor or nurse can help you figure out what the best combination is for you. So what about e-cigarettes? Sometimes people wonder if using electronic cigarettes or e-cigarettes can help them quit smoking. Using e-cigarettes is also called vaping. Doctors do not recommend e-cigarettes in place of medications and counseling. That's because e-cigarettes still contain nicotine as well as other substances that might be harmful. It is also not clear how they can affect your personal health in the long term. What if you're pregnant and you smoke? If you're pregnant, it is really important for your health and the baby's health that you quit as soon as possible. Will you gain weight if you quit? You might gain a few pounds. This can be frustrating for some people, but it's important to remember that you're improving your health by quitting smoking. You can help prevent gaining the weight by staying active and eating a healthy diet. What if you are not able to quit? What if you're not able to quit? If you don't quit on your first try, or if you quit but then start smoking again, don't give up hope. Lots of people have tried more than once before they're able to completely quit. It might help to try to understand why quitting will not work. There may be something you can do differently when you try again. It can help to figure out what situations make you want to smoke and therefore avoid these situations. So what else can you do to improve your chances of quitting? You can get regular exercise. Anytime physical activity, even gentle forms of movement, is good for your health. Physical activity can also help reduce your stress. Stay away from smokers and places that make you want to smoke. If people close to you smoke, ask them to quit with you or avoid smoking around you. Carry gum, hard candy, or something to put in your mouth. If you get a craving for a cigarette, try one of these things instead. And don't give up. Even if you start smoking again, it takes most people a few tries before they succeed. So I want to thank you for watching this whole video. I hope you learned something about how to quit smoking and that you're motivated and educated as to what things can help you quit. If you need more help, please speak to your doctor or medical provider.